Hi guys, we're going to do a video showing you how the proper setup for a clean contaminated vaginal table should be moving forward. So after you have done your proper hand washing, hand scrubbing in the morning, hand washing just prior to opening your table, gather up all your stuff. You'll need your vag pack, your instruments, and your little thing for your dirty instruments. We are going to require hats to do these tables. Oops, let me get my mask off. We're going to require you to wear a mask while you're setting up the table and your sterile gloves. Okay? So let me garb up. I'll go ahead and get my mask on and get my hats on. Now we're going to pretend that I've already done my hand scrub this morning, just for time's sake. That you'll get taught later, or already maybe. Alright, so first thing, remember this is not a sterile table. This is a clean contaminated table. The whole thing with procedural sterile and surgical sterile, this is a procedure, but it is an invasive procedure, so we do have to follow the guidelines for the invasive procedure. Okay, so I'm going to open up my instruments and keep them clean, where I can get to them. I'm doing this before I get the sterile gloves on. Okay. Now, I don't have one of the ring stands in here, so we're going to improvise.
Oh, sure.
So this, we'll put it right here. That's the ring stand. Okay, and I'm going to go ahead and open that where I can get to it just a little bit. And that's all still good and sterile on the inside. And then I'm going to get my gloves on. Putting on your sterile gloves, remember, you open, lay it out, and you pick up on the cuff, not touching anything on the outside. Get your hand in there and then grab that corner. And you can pull it up. And then go under the cuff on that glove so that you're inside and sterile. Put that hand in and you can bring all that up. And everything's still good and sterile here, okay? And that's still sterile, so we can dump that out of the way. Alright, so then we're going to get into this. We're going to open this up and we're going to find the drape that goes on the table. It has a plastic cover on the back, so when you put it down on this clean but not sterile table, things can't get through it as easily, okay? So, see the plastic? See the difference? Okay? So this is more solid than the other drapes. The other drapes in there are very permeable. Means things can get through there. Lay it out like that, and you can pick up this plastic and open it that way. And then you come back on the other side and do the same thing. And that sets up your clean contaminated field, but you did it sterilely, okay? After that, the main thing is try to think about how the doctor is going to use things. There's all these drapes here. These that have the words toe on it, those are for your legs. He'll need those pretty quick. He will want this one that goes under Mama's bottom first, and then the toe ones, and then he'll need that one that he puts up on Mama's belly after the baby's born. So that's on the bottom, and then the leg ones, and then the under the buttocks one. And then his gown and his towel, and this one's the one that will drape over the top. Okay, so we'll leave it there. And then we're going to get this, one of those. So one of the bulbs and this cleanup sponge that has nothing on here, we're going to be getting rid of this. This is going to get thrown in the trash, okay? So we have a special sponge cleanup and for after the baby's born that we'll show you too. So I'm throwing that in the trash and getting it out of play. These two are going to stay in that on the ring stand, and we're going to cover that back up. All right, to set up the table, this is for the placenta. We're going to put this out there. They use a little cup for some soap. And try to think about what the doctor's going to need first. And usually they put it on this side of them and Mama's here. So things they're going to need to get to when baby comes out and baby's wet and slick, I put over here on this corner. Okay? Good so far?
Mm-hmm. Very good.
Mm-hmm. So we're going to bring these instruments now. We're going to take them off of that string. When baby's born, he's going to want one of these clamps and the scissors. We're going to put those down here close. This is for the umbilical cord. He'll usually pass that off to us to trim that cord up with after the fact. Go ahead and lock down your instruments so when he grabs them, he don't get this. He can just grab it and have it in his hand to work with, okay? These are for sutures. Those are last. If we need them, they're going to be up there out of the way. They may use a ring forceps, so we'll leave one of those. And put the other one kind of up out of the way. These are for the cord. So that's kind of what he might need when baby's being born, okay? So we have baby's coming out. He's got baby. He'll clamp the cord. He'll give this to Dad to cut it. And once baby's handed off, he'll fill this up with blood and lay that over there. And then he'll use these with the bucket to deliver the placenta. He might need ring forceps to kind of help pull that out. And he might need a Kelly clamp to help pull it out. So that's kind of what I put right here. There's no right or wrong to that. If things are in his way, he's going to move them, or her. They will move what they don't need out of the way. Okay? The sponges, there will be a new process with those two that we're teaching. We're going to hang hooks in the rooms with sponge holder bags on them. And there will be one for the little ones and one for the big ones. Okay? So, and we have to use the surge account machine. It is not an option anymore. That's being tracked. It will be kept up with. There will be counseling and corrective action if it's not used. If for some reason you can't use it, if it's broken, the nurse has to put in a work order, say what's wrong, print it, put it on there, and call Biomed. Tell them it's broken, they need to come fix it. Do not delegate that to somebody and say, will you do this for me? Because if they don't do it, it's coming back on you, okay? You were the nurse in the room, it's your responsibility. You cannot break these inner bands until you do actually do the count, and we're not going to actually do the counts anymore until just prior to delivery. So when you call the doctor for delivery and they are on their way, pull the table out, uncover it, count your sponges and your instruments. I'm actually going to have them tape these master barcodes on the side of the bags that are hanging there so they don't get thrown on the floor and lost. Doctor's coming, uncover it, you're going to pop these and you're going to count them out. Okay? And you'll actually have to take them apart. You can't do 1, 2, 3, 4, 5. You have to actually count them out. 1, 2, 3, 4, 5. And you will be being checked off and making sure you're doing this stuff correctly, so make it a habit, okay? And then these 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, okay? So when it has to be an RN and one other person that does this count. Whoever does the initial count with her has to do the count at the end as well. So when you open it and you count your sponges, then you have to count these instruments real quick, and then you're good to go, okay? you can scan in your surge account at that point and hang it on the holder that's in the rooms. Room 4 is missing one, but we are going to get that fixed. For some reason, say at 6:30, you're thinking, oh wow, there's the baby we're fixing to deliver. You uncover it, you do the counts, and then she pushes for another hour. Just like in the OR, when y'all come in and relieve each other, the circulator and the scrub tech that is there now counts with the circulator and the scrub tech that's coming in. Same thing in the room. You will count, the RN and the person that counted will count with the RN taking over and whomever she wants to count with her. And you'll need to document that in your nurse's chart saying the current staff counted out to the oncoming staff, and now that staff is responsible for getting the in counts and getting it all documented. Okay? Okay, so we've got all this set up. We've got the counts. We have a baby. I'm going to talk to the doctors, and as they use these, I'm going to ask them to lay the sponges out on the side. With this being a clean, contaminated table, there's no reason why any one of us can't reach up on the side of the table and take that sponge off and scan it out in your surge account and put it in the bag holder. Make sure you put all your little ones in one bag and your big ones in the other bag, because that's a quick reference. Anybody can look back there and go, oh, I have 5, or I have 10, or the count's good or it's not. So that's a quick reference. If you hand off needles during the repair, you're going to have to count those as well at the end. So we have the baby, he does the repair, he's getting ready to leave. Real quick, we look at our sponges, because if they're being scanned out and put in that bag like they're supposed to be, that's a quick, you can do that as fast as you can count to 15. Okay? And then you have to count all of your instruments, make sure you have the same number of instruments you started with, and then if you've added needles, you have to count those too. And then the nurse has to document in her chart that you counted, and both names of who counted. And then you have to tell the doctor the counts are good. Make sure the doctor verbalizes understanding or responding to, okay, thank you, or I understand, or something. If they don't, say it again. Louder. Until you get a response from the doctor, because you've got to document that too. Once all that's done and the count's done, whoever opened the surge account between the two that started counting first, whoever opened it and started it, the other one finishes it and submits it. So that on the surge account it shows 2 different people involved in that count. Okay? It doesn't look like the PCA opened it and closed it and nobody else had anything to do with it. So make sure you alternate that. So once we've got all the sponges counted out and in the holder accounted for, then the PCA can start tearing down the table and all of that. Okay? The instruments, just like you've been doing, you put them in your little red bucket and you take them into the sold utility room and clean them up and spray them with the blue foam. And you dispose of all of the rest of this the same way you have been as well. Just like any other sterile fill, you're going to open it towards you and then away from you, while your gloves are still good and clean. Okay? And then that blue thing that's in our ante-rooms that goes under the mom's bottom, you throw it up on the top. You can throw the doctor's gloves up there, and you got your ring stand. So also remember, the 4x4s that do not have the Raytec blue line in them is going away. Those are only meant to be used as a dressing after a wound is closed, after skin is closed before they're opened, because you cannot detect them with an x-ray if it gets lost. So we will not open those to do peri-prep. We've got the other thing, and we'll teach that in the class, and then we have that for cleanup as well. Okay? All good?
Good.
All right, let me know if you have any questions.